Hello and welcome. We're coming to you from Delhi's popular Lajpat Nagar Central Market, where it is evident that there is absolutely no fear or concerns regarding the pandemic. Many people here believe that the pandemic is completely over, and hence we've seen many people without face masks, overcrowding in many spots in this particular market, and this is evident that people have simply no fear of the infection any longer. In this episode of COVID 360, we're getting you all the details about the current COVID-19 situation in the country, where there are several pockets of concern in India, even right now, where the positivity rates of the infection continues to be above 25%. What's worse is that the government fears that after the festive season, which means after Diwali, Chhath Puja, Guru Purab, Christmas and New Year's, all of these in the next 2 months or so, COVID-19 cases will go up further in the country. I'm Sneha Mordani. Our top story is about pockets of concern right now in India. We're getting you all the details of those states and districts where positivity rates are extremely high, and these are the areas where cases in fact continue to increase. They contribute to more than 85% of the total number of cases being reported in the country just now. Take a look. Over 16,000 new cases of COVID in India. A 20% increase in 2 days. In absolute numbers, this figure may not send shockwaves, but the gradual increase in high positivity rates in pockets show that the worst is not over. West Bengal has seen a post-Durga Puja spike. Assam too has seen an increase in cases. The positivity rates in some districts in India remain as high as 25%, which means for every 100 tests done, 25 people are testing positive for COVID. The Northeast, experts say, is seeing the tail end of the second wave of the pandemic, but several districts there continue to have positivity rates of over 10%. Delhi's suburb Gurugram is seeing a spike in cases of COVID, forcing authorities to issue an advisory to people at risk to stay at home. The fear is cases could increase until December because of festive gatherings.
जो फेस्टिवल सीजन आ रहा है तो इसके प्रति लोगों को सतर्कता बरतने की ज़रूरत है। जैसे जैसे त्यौहार बढ़ रहे हैं बाज़ारों में या और हम आसपास इलाकों में मॉल में जहाँ देख रहे हैं कि लोग बिना मास्क के यूं ही घूमते हुए नज़र आ रहे हैं, कोई सोशल डिस्टेंसिंग फॉलो नहीं कर रहे।
ये लोगों को ध्यान रखना होगा कि यदि टीकाकरण हो गया है फिर भी वो मास्क लगाएं, अपना हैंड सैनिटाइज करें, भीड़ में जाने से बचें, क्योंकि कुछ बेसिक चीज़ें हैं जिनका अगर हम ध्यान नहीं रखेंगे तो ये श्योर है कि वो इन्फेक्टेड ज़रूर होंगे।
More worrying is the surfacing of cases of the new mutant AY.4.2 in Madhya Pradesh.
जो 9 केसेस आए थे तो उनकी जो कॉन्टैक्ट ट्रेसिंग की गई थी, उनमें से 2 केस उनके फैमिली के फिर से और रिपीट के केस भी कुछ आए थे। तो केस अभी निरंतर बढ़ रहे हैं और चूँकि देख रहे हैं हम लोग के जो कोविड के जो प्रोटोकॉल है वो उसको कोई भी फॉलो नहीं कर रहा है।
A warning that the mutant may spread to cities like Delhi, where complacency has set in because of the current low number of cases.
कोरोना नहीं है,
खत्म हो गई। नहीं, कैसे खत्म हो गई
पता नहीं।
तो हम सब ने पहन रखा है।
हमारी बॉडी में पहले से एंटी वो है, कोरोना बनी हुई है।
अब मास्क नहीं पहन रहे, कोरोना वायरस है। हाँ, आप क्या मानती है? फेस्टिवल के टाइम में निकल
थोड़ा बहुत देखिए, अब बनाना तो है ना फेस्टिवल, ये तो नहीं कि घर में ही बैठे रहेंगे एकदम। फिर ऐसे ही फिर अगर कल को कुछ हो भी गया तो फिर मतलब गम ही रह जाएगा कि कुछ परचेज भी नहीं किया, तो जब मैंने मनाया नहीं, फेस्टिवल ही नहीं मनाया, तो इसी वजह से थोड़ा निकलना भी जरूरी है।
Amid fears of a third wave, the new AY.4.2 variant of coronavirus, a lineage of Delta Plus or AY4, has already reached Karnataka, Maharashtra, Andhra, Kerala, Telangana and Jammu and Kashmir. That's a cause of big worry. With Bureau Inputs, Sneha Mordani in Delhi for India Today. Let's now tell you about the positivity rates in India. 8 states in the country right now have positivity rates more than 10%. Let's get you more details of that. This includes districts in Arunachal Pradesh, in Assam, Kerala, Manipur, Meghalaya, Mizoram, Nagaland and Sikkim. In these states, in some districts here, positivity rate ranges from 25% to 11%. The national average in India is 1.2%, which is way below the World Health Organization's recommendation of below 5%. West Bengal is one of the states that has recorded a post-festive spike already. After Durga Puja celebrations in the state of West Bengal, cases have gone up. On an average, West Bengal is reporting about 800 cases. Take a look.
COVID-19 cases are rising in West Bengal after the week-long festival of Durga Puja this month. While the state ranks in the top 5 list of vaccinated population, the concern is that 20% of COVID-19 infections are among fully vaccinated. The ICMR has written to the state government expressing concern over the spike in COVID cases.
যতটুকুই এফেক্ট হচ্ছে ডাবল ডোজ যারা নিয়েছে তার কারণটা কি? তার কারণ ইমিউনিটিটা 6 মাসের বেশি থাকছে না। আমার মনে হয় টেক আপ দিস ম্যাটার উইথ দ্য সেন্ট্রাল গভর্নমেন্ট অলসো, হেলথ মিনিস্ট্রি অলসো, যে সেকেন্ড ডোজ নেওয়ার পরে কেন হবে? একটা দুটো নয়, আমি দেখছি ম্যাক্সিমাম সেকেন্ড ডোজ নেওয়ার পরে যাদের হচ্ছে সেটা হয়তো হতে পারে যে মৃত্যুর দিকে যাচ্ছে না, হয়তো তার মৃত্যুর দিকে যারা গেছে তারা আগেই মারা গেছে, কিন্তু হবে কেন? তাহলে ইমিউনিটিটা কেন পড়ে যাচ্ছে? হোয়াট ইজ দ্য কজ? এটা কি গভর্নমেন্ট অফ ইন্ডিয়া কোনো রিসার্চ করে দেখেছে?
Currently, over 7 crore 44 lakh people have been vaccinated in the state, which includes more than 2 crore 5 lakh who have received their second dose as well.
Entire gathering of people, first of all, the messaging to the people was completely wrong. Secondly was कि हम लोग इतने लाखों हजारों को 4-5 दिन से इकट्ठा किए तो उसको तो भुगतना ही पड़ेगा.
Kolkata police are now conducting checks to ensure people are wearing masks in public. There is a night curfew from 11 p.m. to 5 a.m. A lockdown too has been imposed in Sonarpur and South 24 Parganas district for 3 days, which is 19 containment zones so far.
COVID-19 cases have gone up in West Bengal after the festive season of Durga Puja, which is a cause of concern. The West Bengal administration has also noticed that of the people that have contracted COVID, 20% of them have been doubly vaccinated, and that is a big question as to what happens when it comes to the immunity. With camera person Prabir Biswas, Prema Rajaman, Kolkata for India Today.
World over, there are countries that are recording a fresh spike of COVID-19 cases. This includes countries from the European Union, New Zealand, UK, for example, and also Russia. There is a concern that there could be yet another wave of COVID-19 in many of these countries outside of India. Take a look.
Is the pandemic making a comeback? 2 years since the global outbreak. Fresh surge are being reported in United Kingdom, neighbouring European Union nations, Russia and New Zealand, raising fears of yet another deadly wave. United Kingdom. About 52,009 people in Britain have tested positive for COVID-19, marking the first time that figure has been above 50,000 since July 17th. The country also reported 115 coronavirus-related deaths. The total number of COVID deaths in Britain is now nearly at 1.4 lakhs. Health officials suggest the AY4.2 variant may be behind the sudden spike.
A sudden spike in COVID-19 cases is being seen in countries such as the United Kingdom, Russia, as well as in Israel. Scientists suggest that the AY4.2 may be behind these sudden spikes. Although not alarming, but certainly this new variant of the Delta Plus lineage has taken hold in these countries where Russia is looking at record deaths and some other nations have had to go through stricter quarantine and lockdown measures once again, despite having vaccinated even with the third booster doses.
But UK is confident of containing the spread without lockdown.
Prime Minister, is a full lockdown this winter with stay-at-home advice, shops closing, is that out of the question?
I've got to tell you at the moment that we see absolutely nothing to indicate that that's on the cards.
Last week, Russian President Vladimir Putin approved a government proposal for a week-long workplace shutdown starting from November to combat a sharp rise in COVID cases and deaths. Last week, Russia reported 1,106 deaths in 24 hours, the highest since the start of the pandemic. The record numbers forcing partial lockdowns and putting pressure on health workers and hospitals.
Hospitalization is more active now. About 10% of patients are discharged every day and an equal number are admitted to the hospital on the same day. There are many more patients than in the previous coronavirus wave.
Большинство из них, 98%, 99%, не вакцинированы.
New Zealand reported 109 locally acquired coronavirus cases last Monday. Most were reported from Auckland. Kiwis also saw their second worst day of daily infections since the pandemic began. Initially lauded for stalling COVID, the Jacinda Ardern government of tiny island nation has been unable to fight the rise of Delta variant. Despite a crippling 2-month lockdown in Auckland, the most populous city. Tumbling COVID counts led some US schools to consider relaxing mask norms. But deaths have worryingly crept up in the last few weeks. Some rural hospitals showing signs of strain, even as the country is powering ahead with vaccinations of children.
States have now placed their initial orders of vaccine for kids. And upon FDA authorization of the vaccine, millions of doses will be shipped immediately to tens of thousands of pediatricians, family doctors, children's hospitals, community health centers, rural health clinics, and pharmacies. Providers, parents, and kids know and trust.
Easing COVID curbs, rise of Delta and other mutants are resulting in COVID surge in many nations. While high vaccination rates have brought down hospitalization, worries about yet another wave appears to be more real. With Sneha Mordani in New Delhi, Bureau Report, India Today.
There's also a problem in the country where the virus is believed to have originated almost 2 years ago. China is recording a fresh spike of COVID-19 cases, prompting many in the world to believe that it really is not over and the worst maybe is yet to come. In spite of record vaccinations, there are several places in China that are recording a fresh spike of COVID-19 cases. What more, there is a lockdown also that has been imposed in several parts of this country. Take a look.
The country where it all began. China is now struggling to contain a monster COVID surge, imposing a strict lockdown in Lanzhou, a city of 40 lakh, days after strict COVID curbs in Zhejiang County. Residents of Lanzhou have been barred from leaving homes if it's not an emergency. While transport services are working, access to tourist places have been restricted in northern China.
Beijing saw 5 new confirmed local COVID-19 cases and 1 asymptomatic local case, all related to cases from outside the capital.
Several housing blocks in capital Beijing have been locked down. A marathon race with 30,000 expected participants was postponed. Beijing also continues to enforce curbs on foreign arrivals with a 21-day quarantine, just 100 days before it's scheduled to hold the Winter Olympics in February. The city of Wuhan, where coronavirus was first identified in 2019, cancelled another marathon with 26,000 participants. Despite the COVID surge, China will keep on exporting vaccines and medical equipment.
Last year, China donated large batches of anti-pandemic supplies, including protection suits, masks and ventilators to 150 countries and 13 international organizations. Since the beginning of this year, we have offered 1.5 billion doses of COVID-19 vaccines to 106 countries and 4 international organizations, ranking the first in the world.
On June 19, 2021, China claimed that it achieved the 1 billion vaccine doses mark in the country. But then came the question of the efficacy of the China-made vaccines. Vaccines made by Sinopharm and Sinovac were used by governments across the world who are now having to depend on US and European alternatives such as Pfizer and Mordani and AstraZeneca for booster doses. The efficacy of the Chinese-made vaccines is somewhere between 50 to 80%, especially against the Delta variant that's causing a rise in the number of cases in China again, leading for many provinces to go under lockdown.
Will the fresh outbreak in China become a threat for the world once again? With Milind Sharma, Bureau Report, India Today.
Internationally, the R value or the reproductive factor or the reproductive rate is increasing in many countries. Reproductive rate is an indication of the speed at which the virus really is spreading. For example, if the reproductive rate is 1, it shows that one infected patient can infect another one patient. If the reproductive rate is 2, it shows that one patient can then infect 2 other people and then pass on the COVID-19 infection. Let's take a look at the reproductive rate in different parts of the world. The R value is about 1 in many countries. In India, it stands at 0.84%, almost close to 1. It's 1.1 in Russia, 1.6 in China. It is close to 1 in the US, Canada, UK, Brazil and Australia. An RO factor above 1 is an indication that the infection is spreading rather fast. The novel coronavirus, like all other viruses, will mutate. It's the nature of the virus. And this virus too is mutating. And there is a new variant that the world now knows about. It is the AY.4.2 mutant variant. And it is believed to be more transmissible than the original Delta variant. This is currently called the Delta Plus variant. As per leading scientists based out of Columbia University, as many as 75 AY lineages of coronavirus have been identified up until now. AY.4 is one such subvariant which is rapidly branching out and steadily rising in parts of the UK, which is seeing a drastic spike in Delta variant cases for the past few months. As many as 63% of the new cases in the UK in the past month have been genomically sequenced to have the AY.4.2 variant. Further, the AY.4.2 sublineage has also been traced in parts of Europe, including Denmark and Germany. Researchers have raised fears that the lineage belonging to the fast-spreading Delta variant could be very infectious and cause repeat surges across the world. Well, though a lot remains unknown about the lineage right now, experts do believe that its origin from the Delta variant could possibly signal worse COVID-19 symptoms. It could be more infectious and spread rapidly. There's also little evidence that the current variant under question renders vaccine-driven antibodies or present immunity ineffective. Well, this variant has been found in some pockets in India as well, and the government says that they are studying the nature of this mutating variant. Now, talking about India and India's vaccination drive right now, there is a huge concern that India's second dose vaccination coverage is extremely low and that it needs to pick up pace. It is for this reason that the central government is raising this issue time and again with the states. We take a look at how low the second dose coverage in India is right now and what governments across the country are doing about it. 12 crore Indians are due their second dose of COVID vaccine and have not taken it. A stunning claim by the government and a big worry too.
The immunization is not complete till both the doses have been given. It is the second dose which exponentially raises the immunity level to the maximum possible immunity that the vaccine can give.
On Wednesday, Union Health Minister met state health ministers to find ways to get these 10 crore people take their dose number 2.
हम हर घर दस्तक करके कोविड वैक्सीनेशन के लिए एक महाअभियान चालू कर रहे हैं। घर घर पे जाएंगे, फर्स्ट डोज बाकी है उसको फर्स्ट डोज लगाने के लिए आग्रह करेंगे और लगाएंगे। सेकंड डोज जिन्होंने नहीं लिया है ऐसे 12 करोड़ लोगों को आइडेंटिफाई करके उसको भी वैक्सीन लगाएंगे।
The center has reasons to be concerned. The deadline to vaccinate the entire adult population is getting nearer. India has so far fully vaccinated about 33% of its population. A majority of them, over 76%, have got only one dose, which means only limited protection. The Union Health Secretary has also written to all states asking them to do much more to get the eligible population for the second dose back to the vaccination booths and also ensure that complete vaccination is ensured, especially at a time when a spike in cases in weeks and months to come is expected.
We have now reached a stage of about 75 to 80% of the adult population having received at least one dose. There is enough data that we are finding that one dose is providing tremendous amount of protection from hospitalization and death as well. That does not mean that we do not take the second dose. We have to take the second dose.
Till now, 71.24 crore first doses covering 76% of the eligible population and 30.06 crore second doses covering 32% of the eligible population have been administered. The government has now told states to focus on areas of low coverage, tighten up vaccination centers and improve access in rural areas if it has to meet the ambitious target of vaccinating the entire adult population by the end of this year. With inputs from Ravish Pal Singh in Bhopal and Ashish Srivastav in Lucknow, Sneha Mordani in Delhi for India Today. From complacency to indifference to sheer confusion, there are many reasons why several people in the country are reluctant to take the second dose of the vaccine or simply are not wanting to take it. Listen in.
पहला डोज मेरे को 1 जुलाई को लगा था और दूसरा डोज मेरे को लगना था सितंबर से अक्टूबर के बीच में। मेरे पास अभी तक कोई मैसेज नहीं आया है और क्योंकि वहाँ पे जब टीका लगवाने जाओ तो वो मैसेज देखते हैं जब वो दूसरा डोज देते हैं।
दूसरी मैंने इसलिए नहीं लगाई कि सरकार ने पहले कहा था कि 14 दिन फिर 28 दिन करते करते सरकार डेट बढ़ाती गई। ठीक है, तो सरकार जब खुद ही स्पष्ट नहीं है कि उसको कितने दिनों में लगाना है और कितने दिनों में बाद करना है।
एक डोज लगवा लिया।
अच्छा, तो दूसरी अभी लगवाई है?
अभी नहीं लगवाई।
क्यों, क्या वजह है?
अभी लगवाने को वैसा नहीं, को कोरोना फैल नहीं रहा है, कुछ है नहीं भी, कोई लगाने को फायदा नहीं भी।
तो आपका क्या आगे कुछ प्लान है कि कैसे क्या करेंगे?
आगे जब होगा लगवा लिया जाएगा, समय होगा। अभी फिलहाल समय भी नहीं मिलता है काम करने।
We are pausing here for a quick commercial break. Much more news around the pandemic on the other side of this break. Apart from Diwali, the Chhath Puja celebrations also round the corner. And this time around, the Delhi Disaster Management Authority has decided to lift the ban on Chhath Puja celebrations. The DDMA held a meeting on Wednesday to discuss the COVID situation in the national capital and reconsider the ban imposed on Chhath Puja celebrations in public places earlier. Well, Delhi Deputy Chief Minister Manish Sisodia informed the situation in the national capital is under control. Hence, Chhath Puja celebrations will be allowed at public places but with strict guidelines and restrictions on the number of people. There will be no permission to offer puja at Yamuna banks in Delhi. Chhath Puja to be observed only at designated public places. Limited number of people will be allowed at the designated places. Safety protocol like social distancing, wearing masks needs to be followed.
जो दिल्ली सरकार द्वारा पहले भी छठ पूजा समितियों के साथ मिलकर अलग-अलग घाट बनाए जाते रहे हैं, तो उसकी एक पूरी सूची जारी की जाएगी और उन सब पर छठ समितियों के साथ मिलकर छठ पूजा का आयोजन होगा।
Well, that's all we could pack in this edition of COVID 360. Hope you enjoyed watching the show. Until next time, stay safe, do follow all COVID appropriate behavior and get a shot against COVID-19 if you haven't already. Thanks for watching.